Hello there, I'm Tony Meekum. This is part one of anatomy review for my second year course. If you've seen my YouTube channel and you notice there's a lot of similar videos, that's because I tend to record new ones each year. Each one has to be tailored for the certain class. And so you could go back and look at previous material, but it should be similar to what I'm teaching now. And so in this three-part series, this first one is just going to cover some foundational concepts about how bone looks in radiographs. The second one is going to cover maxillary and mandibular structures on intraoral radiographs, and then the third one is a quick panoramic review. So again, this is review material. You should have had radiographic anatomy before. I'm going to go pretty quickly. If something feels unfamiliar, treat that as a signal that you need to go back and review some of the previous material. First concept here is the eggshell effect. This is one of those geometric principles that explains a lot of what you see in radiographs. So this is a radiograph of an actual eggshell. And why does it have this white border around it? Is the eggshell thicker in that spot? Well, no, not really, but this diagram kind of shows it. See how if the x-ray passes at 90 degrees to the border of the egg, then it's only going to pass through a very small thickness of that dense calcified border. But if it passes tangentially, like it does at the top, as we see here, then it passes through a lot thicker of the border of the egg. And that means a lot more of those x-rays get attenuated, and it's going to appear a lot more opaque. As x-rays get blocked out, things tend to appear opaque or white in an image. And so that's what we see in the egg here, but it also accounts for a lot of things we see on radiographs: the lamina dura, the alveolar crest, the border of the maxillary sinuses and nasal cavity, but also it explains corticated borders of cysts and tumors. Those benign type of things, I said they grow kind of slowly, they maintain their shape, and bone can lay down new bone around it, and that's what forms that corticated border. And so this is a good sign to know in radiographic interpretation. All right, thought question for you. Will you ever see this on a soft tissue structure like a tongue? Do you expect to see a corticated border around the tongue? What do you think? No, you shouldn't. Why is that? Because the tongue does not have a cortex around it. It doesn't have a shell of hard tissue around it. So anything that's soft tissue, you expect not to see corticated border. So if you do see that corticated border, do not assume that it's something like the tongue or just fluid like we'll see sometimes in the sinus. If it's purely just fluid, then it's not going to have a corticated border, and that makes a big difference in our differential when we see something there. But if you do see that corticated border in a lesion like this, then that's a good sign that it's something benign. All right, next concept is going to be the lamina dura. This is the eggshell effect applied to the bone around teeth, around the socket of teeth. Just like an eggshell, bone has cortices around them. And so that bone, if the x-ray passes tangentially through it, like it does on the side of a socket, is going to form that thin radiopaque line around it. And so that's our lamina dura, we call it. You may notice, like in this, in the same patient, there's a lot of variation. So don't expect to see it the same thickness everywhere, even in health. So it's a lot thicker on this tooth right there than it is at the bottom, a little bit thinner on the other side. And so there is going to be some variation there. But the more you look at these, the more you get used to that anatomical variation and what's normal and what may be abnormal. All right, then what about the alveolar crest? Well, that's similar. That's just the eggshell effect on this interproximal portion of bone. We see on the maxilla and the mandible both occlusally. So the top part of the bone of the mandible, the bottom part of the bone in the maxilla, as it gets closer to the teeth, that bone tends to angle off like this, and it should be roughly at a 90-degree angle, and it should be continuous with the lamina dura. This is from a well-known periodontal paper in 1991 that showed that the measurement of the CEJ, the cemento enamel junction, to the alveolar crest, it should be 2 millimeters or less. And in fact, what this showed was with the 95% confidence limit, that was 1.9 millimeters to 0.4 millimeters. So if you ever start to get that distance larger than 2 millimeters, you should be thinking periodontal bone loss. And also continuity matters. See how this is continuous here and it angles with the lamina dura? When you very first start to see periodontal bone loss, that angle just starts to resorb away. And so look for that. That could be an initial sign of periodontal bone loss. But if the bone level is way down here, then you know you have pretty severe periodontal bone loss. All right, next concept is going to be cancellous bone. And what this shows is the variation between the maxilla and the mandible. So what you're seeing in a radiograph is a combination of marrow space, which appears less dense because it's fatty, and then also trabeculation, which is these lines that you see in here. And that appears as these radiopaque lines. And the variation I was talking about between the maxilla and the mandible is that the mandible, you notice, has these wider marrow spaces. It also has kind of thicker, more well-defined trabecular lines, whereas these are a little thinner. The marrow spaces, they're closer together. So that's normal variation. In the same patient, You'll see variation between different patients, but also within the same patient, even the same bone. A lot of times you see in the inferior mandible, that bone just tends to have really spread out trabeculation, kind of more marrow space than it does trabeculation. A lot of times I get question of, is that pathology or not? What do I like to do as a radiologist? I like to compare to the other side. And if the other side looks really similar and it just looks like anatomical variation, then that's a good chance that's what it is. And then also you'll see more of that as patients age. They get osteoporotic. Some of that bone tends to demineralize. And so you get a lot more of the low density bone, kind of the larger marrow spaces. So that's a common occurrence. All right, on to the next slide here. So we talk about the PDL spaces. This is just that thin gap between the lamina dura and the tooth. And there's just soft tissue there. There's a ligament, the periodontal ligament is what I mean by PDL. And that's why it appears radiolucent. Soft tissue structures typically tend to appear radiolucent compared to bone, which is more calcified. And it should be relatively thin and uniform, but you will notice that there's some variation, even looking at these radiographs. You see on this side of this tooth, it's fairly thick, but still within the range of normal variation, I would say. On the other side, it's relatively thin. Look at the lamina dura for comparison too. The lamina dura is a lot thicker over here, and it's thinner over there. Kind of invisible here. Does that mean there's pathology? Not always. Just get used to the fact that there's going to be some degree of variation, even within the same patient as you look through these. All right, quick trick question for you. Here you see two radiolucent lines on this side of the tooth. Which one is the lamina dura? Give you a second to look at that. Is it this one or is it that one? Or if you've seen these before, maybe you're already thinking this. How about both? Yeah. And so this is what's happening. This part of mandibular molars a lot of times kind of is ribbon in shape or hourglass in shape. And so the X-ray beam, as it's passing tangential through the lingual lamina dura, it creates one line of lamina dura, and it passes through the buccal lamina dura, it creates another one. You see a similar thing on this first molar here. And so that's just kind of an indentation in that part of the root of the canal. Both are PDL spaces, both are healthy, just kind of a quirk of two-dimensional projection. And so that covers our foundational concepts: eggshell effect, lamina dura, alveolar crest, trabecular bone, and PDL space. And the next one will go through the actual specific structures of the maxilla and mandible that you should be able to identify in any intraoral radiograph. So we'll see you on that one. Thanks.